Hello everyone, I welcome you all to Dr. Rohini's Sthree, a channel dedicated to women's health. Today let us try to understand what are the causes, reasons for polycystic ovarian syndrome, why it happens. Once a girl or woman is diagnosed with PCOD, she is a lifelong PCOD. It means it cannot be cured, just like diabetes or hypertension, which once they are diagnosed, we cannot cure it, but we can control it with medications. So in the same way, once PCOD is a lifelong PCOD, she can have long-term implications on our health. Even after menopause, she can have implications on our health. So the most important cause for this PCOD is just like diabetes, hypertension, other diseases. The most common cause is genetics or hereditary. So if a woman has PCOD, in 70% of the times, there is high chance of transferring this PCOD to her daughter. So it's not that it's only from the genes of the mother, even from the genes of the father also, a baby can have, a daughter can have PCOD, especially in a man who has premature balding, that is having baldness at a very young age, that which is because of the excessive testosterone hormones. Even as a genetic cause, even the daughter of such man also can have high risk of having PCOD. So other important genetic factor could be what we call it as parents with metabolic syndrome. So what is metabolic syndrome is if the parents have obesity, diabetes, hypertension, hyperlipidemia. So when they have all these problems, there is high chance of they will be having insulin resistant and hyperinsulinemia. So this insulin resistance can be transferred genetically to the children. So parents with metabolic syndrome have a high chance of having children, daughters with polycystic ovarian syndrome. So these are all the genetic factors. When it comes to the non-genetic factors, especially when a pregnant woman takes some medications which can have androgenic effects on the fetus. So those medications, if she takes during pregnancy, especially during the first 3 or 4 months of pregnancy, that can permanently have effect on the female fetus. So that is the reason we always tell the pregnant ladies, whenever they are taking any medications or anything, they should always consult their doctor. They should know whether whatever the medications they are taking are safe in pregnancy or not. So because some of those medications can have permanent effect on their growing fetus. So the other important non-genetic factor which could be the reason for having polycystic ovarian syndrome is obesity. So what is obesity? In my last videos, I have already mentioned what is BMI, what is obesity, when we consider this normal BMI, when it is abnormal. So a BMI of more than 30, we label it as obesity. So what happens in obesity is there is insulin resistance. It means the effect of the insulin on the tissues is reduced. It will not be that effective. So just to compensate that, there is increased secretion of insulin, which we call it as hyperinsulinemia. So once there is increased insulin levels in the body, that will in turn increases the levels of the hormone called as luteinizing hormone or LH. So this LH in turn increases the secretion or production and secretion of androgen hormones in the ovaries. So mainly the main hormonal imbalance in PCOD is, one is hyperandrogenism, the other one is hyperinsulinemia. They both are very much interrelated to each other. So the obesity in turn increases PCOD, and the PCOD in turn worsens obesity. So they both are, we don't know whether obesity and PCOD, they are the cause and effect. Which is the cause, which is the effect, we don't know, but they both are very much interrelated to and interconnected to each other. One worsens the other. So that is the main reason we say what the first advice we give to the PCOD patients is, if they are obese, to lose weight. So what happens when they lose weight, when the fat cells decreases, what happens is that insulin resistance comes down. So the hyperinsulinemia gets corrected, and that reduces the levels of androgen hormones in the body. So these are the two main hormonal imbalance, and they automatically get corrected once we correct the obesity. So that is the main reason we tell patients to reduce weight whenever we diagnose PCOD. So what happened, more than 50% of the times the hormonal imbalance gets corrected, and that can restore their normal menstrual cycles, and they can have spontaneous pregnancies. So it is very important to lose weight, especially in patients with PCOD. So the other important cause is endocrine disrupting chemicals. So in my previous videos, I've already given a detailed description about what are endocrine disrupting chemicals, what are the effects it can have on a woman's health, all those. So one of the deadly endocrine disrupting chemical is bisphenol A or BPA, which is abundantly found in the plastics which we are widely using, and in the children's toys, and in the canned foods, stored foods. So in all these day-to-day things which we are using, we have lots of endocrine disrupting chemicals. So this is one of the important reason for the increase in PCOD. So these are all the reasons which could be the most important reasons for the development of polycystic ovaries. So I think this is enough for today. In my next video, we will try to understand what are the effects of this PCOD, what all adverse effects it can have on a girl's or a woman's body, and how to tackle them. Till then, take care. Bye. If you like these videos, please like, comment and share. And for more updates on women's health, please subscribe to my channel and don't forget to press the notification bell.